Hello and welcome to Dr. Carri's Clinical Corner. Today I want to talk about pelvic floor therapy in pregnancy and how we can use pelvic floor therapy to help prepare the pelvis for birth. So this is one of my favorite things to work on in the clinic. I think it's so fun. But what we do in pelvic floor therapy when you're preparing for birth is we test different birthing positions to see where your pelvic floor muscles are most relaxed. So this is the goal of all of this, is to prepare for a vaginal birth and decrease the risk of tearing. And so we test different positions to see where your pelvic floor muscles are most relaxed. So then hopefully in that position you can push and things will be relaxed and less likely to tear. And so we have these sensors that connect to the pelvic floor, and they show us on a screen like how much activity the pelvic floor muscles have in each position. And so it's pretty cool. And what I've noticed over the years of doing this is people feel it, like I can kind of see on their face, and they feel like, I don't really feel comfortable here. Like one example is like on your hands and knees, we test that. And some people are like, this feels great. And a lot of people are like, oh, I just don't feel relaxed here. And then when we put them in a position where they do feel relaxed, you can like see it on their face. So most moms, they feel really relaxed on laying on their side because that's how they've been sleeping for months. And then we also we can try like squatting, kneeling, standing or kneeling, leaning over the table, or like in the hospital it would be the bed. That often is a really good position for people because they feel their pelvis is open and gravity is helping them, but they also can sort of like, they feel supported on their upper body. We can practice with the leaning over like a birthing ball. You can practice on your back. Like I always use that as kind of a test too. Not to say it's bad to give birth on your back, but so the cool thing that I've noticed over time is that like what we see in the technology, the sensors, when the pelvic floor is relaxed, then like mom feels good in that position. So if you're interested, if you're pregnant, I have an online course that goes through all the things that I do in the clinic, but it's online. And so I tell people like, go through the different positions. They're all in the online course, and then see where you feel most comfortable. And the other thing is I tell people, this is just a test. Like when it actually comes to labor and delivery, like who knows? Sometimes there's a lot of factors outside of our control. Like, is baby face up, right? And then they don't want you to move, right? Or do you get in a certain position and baby's heart rate decelerates, right? So there's things like that that come up. So I tell people like, this is not set in stone. This is just sort of like an idea. And I want you to think about what your body feels like in these positions. And so take that into labor and delivery with you. And then some other things that we work on is we practice Kegels and we practice pushing. So when it comes to give birth, your pelvic floor muscles are not pushing the baby out, but I'm using my hands as an example. So a Kegel is sort of tightening and pulling everything in. And pushing, we want things to relax and push out and stay open and relaxed while we push. So the pushing comes from the uterine contractions above, but we're just sort of opening up. And so we, again, test that with the sensors on the pelvic floor and see, do you know how to push? Or like when you push, are you actually tightening? And this is a huge piece of it, I think, for birth and tearing. So again, there's a lot of factors out of your control when it comes to birth. But if you think you're pushing, but you're actually squeezing the muscle, then like it's really gonna be really hard for a baby to get out, right? So we make sure like at baseline, are your muscles relaxed? And then, do you know how to Kegel, but also do you know how to push? So if you watch my other videos, I'm not a huge fan of Kegels in pregnancy for this reason. So sometimes I teach people Kegels in pregnancy, but more often, if they're not having any reason to do them, they don't have any bladder issues or pain or things like that, then generally I'm like, don't do Kegels, because when it comes time to give birth, we need things to relax and open. So we want to know at baseline, are they relaxed? Can they push? And then we test different birthing positions. And that's like the gist of what we do. And then I also give them some hip opener stretches to do. And so, yeah, if you saw my video on perineum stretching, there's some tools you can use. So we go over that. I'll link that video below. And then, yeah, I also demonstrate what perineum stretching should feel like. And so they can do it on their own. And like, if they want to try it with one of the tools, I have them in the clinic and we use a condom over it for sanitation. And we also sanitize everything. But then they can test it, you know, they can feel what perineum stretching should feel like, because it's sort of like you read this or you watch videos and it's like, I don't know what that means. So I always tell people perineum stretching should not hurt. You might feel a little stretching, a little burning, but it shouldn't hurt. And so we want to sort of practice that. There's some evidence that that can help, you know, before. And mostly what I tell people is like, if you have any tightness in those muscles, we want to work that out before you get into labor. So all those tissues can stretch and open. If you have tight spots or your pelvic floor is tight, then it's going to be really hard for baby to get out. So biology takes over, nature takes over, and the hormones take over, and that helps the process, but we want the environment to be as prepared as possible. So that's really what we do, and it's so fun, and moms leave feeling really empowered by that session. And I would say, you know, I tell people like C-sections happen for a variety of reasons, so we can't necessarily prevent C-section because often that's a medical reason and that has nothing really to do with your pelvic floor. But we can't also say like you're not going to have any tearing. I mean, I hope so, but you know, we're hoping to help the process, you know, minimize tearing and then help you recover too. So it's really fun. Come see me in person or another pelvic floor therapist near you who does this. Or like I said, my online course goes over all these things and just without the in-person touch, but it gives you all the details. So I will link all that below.